Well, good afternoon. I'm pleased to be here today with my friend Flavio Volpe from the Auto Parts Manufacturing Association, our Economic Development Minister, Vic Fedeli, our Deputy Premier and Health Minister, Christine Elliott, and Finance Minister, Rod Phillips. As of last night, over 35,000 people have used the interactive online self-assessment tool for COVID-19. I want to remind everyone to please use this tool if you're experiencing symptoms. Please do not visit an assessment center unless you've been asked to by a healthcare professional. If you're experiencing mild symptoms, please stay at home. We're all responsible for reducing the spread of this virus. We all need to do our part to protect those who may be vulnerable to more severe symptoms. Around the world, there's a high demand for essential medical supplies and equipment. And as a result, there's a shortage of these supplies around the world, even here in Canada. Earlier this week, I put out a call for help, and the response from the business community was absolutely incredible. The Ontario spirit never ceases to amaze me. There are people like Flavio and his members who immediately answered the call. Companies like Martin Rea, Linamar, and General Motors Canada, who have offered to retool some of their facilities to help make metal equipment. Minister Fedeli and our Deputy Minister for Economic Development are all over this right now. It's their #1 priority. In fact, we've assigned an entire team to work on this full time. We heard from 2 Ontario entrepreneurs. One has an open source ventilator design, and the other is a manufacturer. And now we have them working together to try and build this equipment for hospitals. When I spoke to CEOs of retail chains in Ontario last week, some of them were offering their parking lots for mobile testing units and their delivery trucks to help deliver food or essentials to those in need. We've even heard from the World Economic Forum. They saw what's happening here in Ontario, and now they're talking to automakers to ask for their help. And they're holding our companies up as an example to the world for their generosity and urging businesses in other jurisdictions to follow their lead. Here in Ontario, it's happening everywhere. The world is noticing how we've pulled together. And we have to keep going. We need to show results. My message to the people of Ontario today and to our provincial and federal partners is this: we're ready to mobilize Ontario's manufacturing might to help the entire country. We want Ontario to be the workshop of Canada in the fight against COVID-19. Throughout our proud history, from the First World War to the war in Afghanistan, from Hurricane Katrina to the devastating earthquake in Haiti, Ontario's manufacturing sector and business community have always been there to respond to the country's needs and to the needs of others. During critical moments in our past, we've always been able to band together and mobilize our industry to help people keep the province and our country going. Ontario is a province of nation builders, pioneers, and innovators. We're home to 5 of the world's top auto manufacturing companies. We have some of the brightest, smartest people in the entire world working on innovative products and making breakthroughs in research in every field. Ontario is the beating economic heart of Canada, the largest economy in Confederation, and a powerhouse of wealth creation that benefits the entire country. And right now, we need to harness that engine. Our frontline healthcare workers are running out of key items. We need ventilators, face masks, surgical gowns, protective eyewear, hand sanitizer, disinfecting wipes, swabs, medical gloves, and lab testing equipment. My message to business owners in Ontario is this: if you can retool your business to make these products, if you can supply these essential items, we need to hear from you right now. If you need funding to make it happen, we'll find a way to help you. We know what we need. We know the products that are in short supply. We know what we need here in Ontario, and just as important, we know what our neighboring provinces and fellow Canadians need. And that's why today we're launching a new website called Ontario Together. We encourage those who can help deliver essential supplies to go to this website and let us know. We're going to search the Ontario marketplace. We will work with any business or individual. We'll leave no stone unturned because we're doing this for Ontario and we're doing this for Canada, for our nurses, doctors, frontline workers, for the grocery clerks, truck drivers, and shift workers, for every family and household, for everyone. My friends, the best part of all of this, we're going to make these supplies right here in Ontario, right here in Canada. Supplies that will be made by Canadians, for Canadians. My friends, during the most difficult times in our country's history, we've always come together. We want our industry to know your province needs you, your country needs you. And if you give us the tools to fight this virus, we will take it down. And our economy will come back stronger than ever before. By making these essential items, you will save lives, you will support Ontario workers, and you will help us beat COVID-19. With that, I'd like to invite Minister Fedeli up to share more details about our call to action.
Thank you, Premier, for your inspirational words and for your leadership. The impact of COVID-19 on our province is changing each and every day. And despite the constantly shifting landscape, one thing has remained the same: Ontario's ability to come together in times of adversity, roll up our sleeves, and get to work. Across the province, each and every one of us has a role to play in the fight against COVID-19. This is an unprecedented time, a time that will require our commitment, our ingenuity, and our strength. Extraordinary times call for an extraordinary response. And the response from business community has been truly extraordinary. Our job as government is to make it as easy as possible for our innovators and entrepreneurs to work with us. Since the onset of COVID-19, Ontario businesses have offered their assistance and support to help protect the health and well-being of people all across the province. Alcohol distilleries such as Dillon's, Kinsip, Corby Spirit and Wine, and Spirit of York have all lent a helping hand to produce hand sanitizers. Amazon is hiring hundreds of new employees, increasing their pay by $2, and taking precautions in their fulfillment centres to keep people healthy. As the Premier said, we're proud to be joined by Flavio Volpe today from the Automotive Parts Manufacturers Association. In addition, we're looking forward to leveraging Ontario's world-class manufacturing and IT centres to provide the assistance necessary to combat COVID-19. We want to see this type of teamwork everywhere and in every sector of our economy. That's why, through our new portal, Ontario Together, we're making it easier for Ontario businesses to team up with the province. Ontario Together will let companies submit their proposals for the government to procure in-demand goods and services faster and more efficiently. to ensure our healthcare system and our frontline workers, such as police officers, correctional officers, and social workers, are equipped with what they need to continue to fight against COVID-19. This new portal will also identify where the need is greatest and solicit ideas and advice from Ontario's business and manufacturing communities on how they can meet that need. By removing barriers and posing Ontario-specific problems, our business partners can offer made-in-Ontario products and made-in-Ontario solutions. If you're an executive or an entrepreneur and you think you can help, please go to ontario.ca/Ontario Together. The portal will be updated regularly and identify key priority areas where goods and services are required. And if you see a need government hasn't identified yet, submit your proposal. We'll make sure we look at it. We will leave no stone unturned as we join together with Ontario's great workers and business leaders to fight the spread of COVID-19. Thank you.
Okay, we'll take questions from the phone line. First question.
First question is from Brian Lilly of Toronto Sun. Please go ahead.
Premier, I know that your office has been inundated with offers for help. Will you actually be able to take up all of these offers from manufacturers, from garment makers, from distillers and brewers that are looking to do this? Or is there the chance that maybe people are running off madly in all directions and not being coordinated quite enough?
Well, we have great, first of all, thanks for the question, Brian. We have great coordination right now as the calls are coming in and emails, and they're coming in fast and furious. We're breaking them into sectors. For instance, folks that can do ventilators in one area, people that might be able to do masks in another area, and gloves. We're well organized. We will be getting back to every single person. Brian, the response that we've received since we put the call out there is absolutely incredible. As I've always said, Brian, we have the brightest people, the smartest people in the entire world here in Ontario, and we need their support. We're all in this together, and we're going to get through this together. And I've never seen a response like this from the great people of Ontario, the businesses here in Ontario. We're the economic engine of Canada. I was on the phone the other day with the premiers, and they asked us to see if we can get the ventilators, start manufacturing, because we're the manufacturing powerhouse here in Canada, and not just in Canada. I always say North America, around the world. And we're going to step up, and the businesses are stepping up. Everyone's pitching in, so I'm so grateful for the support out there.
In terms of the website, it does appear to be overwhelmed at the moment, so hopefully that can be fixed. But how do you keep people safe in terms of being able to manufacture these things while asking factories with sewing machines or people that can turn auto parts makers into ventilator makers? How do you keep them safe? You're asking the rest of us to stay home, but these manufacturers will have to have their employees on site.
There's certain areas that are essential. Yeah, we call them essential businesses. I'll give you an example: retail. Retail, the supply chain, we need to keep flowing, but we have to make sure the number one priority is to take care of the frontline workers. And with people coming up with these ideas to practice social distancing, if you're one of these companies that can help us, we'll make sure they have provide the proper equipment, be it N95 respirators, making sure we have proper hand sanitizers, make sure social distancing within any manufacturing facility is minimum 2 meters or 6 feet away. We'll take all precautions to make sure we protect the workers. And we want to thank them. We want to thank them for their sacrifice, for getting out there and making sure that we slow the spread of COVID-19 and put an end to it.
Next question.
Next question comes from Christina Horan of City News. Please go ahead.
Hi, Premier.
Hi, Christina.
Good morning. I'm calling because I really want to find out about what's happening with jails. We know that transfers are still happening within institutions, and we have a couple of presumed positive cases coming out of the northern region right now, inmates just being admitted. Are there any plans to stop transfers between jails?
Well, right now, I know our number one priority, first of all, is to take care of our correctional services guards. They're out there, they're on the front line, making sure that everything's safe in the jails across this province. And I know the Solicitor General is talking to these folks every single day, making sure there's a plan, continue with the plan, I should say, making sure the priority of the frontline workers. But to say that the transfers from jail to jail, we're avoiding this as much as possible. But Christina, I promise you, I will get back to you on that question. I'll confirm it with the Solicitor General on the transfers there.
And then just in terms of the personal protective equipment, all of the COs that I've spoken to, my phone's been blowing up with this, is that there really is not enough PPE going around in the institutions to make them feel safe. Any plans to sort of prioritize those areas? Because they are just hotbeds for contamination.
Yeah, I agree. So we have a priority list to make sure we take care of the most vulnerable out there on the front lines. We're also making sure we have a priority list to make sure the long-term care and seniors' homes, we're focusing on that, on 24/7 screening at long-term care homes, because these are the folks that have a chance of attracting this disease and virus, I should say, and we're going to do everything we can to make sure they're safe. So we do have priorities that we're put in place, and we'll make sure we take care of the frontline people.
Next question.
Next question comes from Sean Shepard of Canadian Press. Please go ahead.
Hi, Sean.
Hi, Premier. Just wanted to ask you today about the measures that would lead you to impose a broader lockdown on the province. We've seen another large spike today in COVID cases, 59 in the morning update. Are there specific standards that you're looking for that might lead you to impose this broader measure?
Well, we're really relying on our Chief Medical Officer of Health, our COVID-19 command table, with some of the brightest medical professionals in the world sitting at that table. So we're taking their advice, and as soon as they direct us to make sure we take further steps, that's exactly what we'll do. We won't hesitate.
And as a follow-up, this may be more for the Minister of Health. Minister Elliott, we understand that the ministry has asked pharmacists, doctors to limit prescription refill to 30 days to prevent any potential for drug shortages or hoarding. I'm wondering if you can talk about that a little bit, and how afraid are you that this may be something that is possible?
Well, we have heard reports from some pharmacists that that is actually happening, that people are asking for 3 or even 6-month refills. We want to make sure that everyone can have access to the medications that they need. So we are looking at 30-day refills just to make sure that the supply will remain available for everyone who does need it.
Okay, next question. Next question.
Next question comes from Angelina King of CBC News. Please go ahead.
Hi, this question's for the Health Minister. Just wondering how many ventilators there are in Ontario right now, and how many you think you will need if this gets to the worst type of situation.
Sure, thank you for the question. Right now, all of our hospitals are equipped with ventilators. I would have to get you the specific number that are out there for that purpose, but they all have them. We have over 200 that were already available wherever we needed them, that are not within a particular hospital, and we just have received 300 new ventilators. But we don't know exactly what's going to be called for in the future. That's why we were calling upon the auto parts manufacturer and other manufacturers, entrepreneurs, and innovators to start preparing Ontario-made ventilators so that we know that we will be prepared for whatever happens. That is really important. Ventilators are going to be critical for dealing with the most difficult cases of COVID-19, and that is why we have Ontario Together out there to encourage manufacturers to come forward to produce more ventilators for us.
Thank you. And I was speaking with plastic surgeons in Ontario. They're working together to kind of get all of their ventilators and private practices to hospitals, saying they're working with you on that. Can you just tell me where that's at and if there's a plan in place on how to get them to hospitals?
Yes, we are very fortunate that a lot of physicians, cosmetic surgeons, as well as some dentists who require ventilators in the course of their practice are coming together. We are actively working on that right now to provide us with their ventilators for use during this time. And that is under active work right now within my ministry. And that will be another great source of ventilators for us for the future.
Next question.
Next question comes from Cynthia Mulligan of City News. Please go ahead.
Hello, Premier. Question for you. Yesterday it was confirmed in Toronto that a homeless person in a shelter was confirmed to be positive. Now, we know the shelters are massively overcrowded. I know Toronto has added 5 new ones, but I'm told by experts that that's still going to lead to overcrowded shelters. They're on top of each other. And then during the day, they're put out into the general community. They'll be on the TTC, for example. What added measures will the province take to keep this contained so that it doesn't spread further in shelters and then therefore in the community?
Well, thanks, Cynthia. I can tell you I'm in communication every single day with Mayor Tory. He's working around the clock along with everyone else. We recommend, you know, if they're going out, and it's very, very tough to keep them in one room with a tremendous amount of other people. If they're going out, when they're coming back, we have to make sure that they sanitize their hands. They have to make sure that they're following proper protocol. When they go out, they're being told to keep social distancing, anywhere from 6 feet to 2 meters away from people. And we will do whatever it takes, I told the mayor, to have more facilities available until people aren't stacked together. So we're working hand in hand with Mayor Tory and other municipalities, all 444 municipalities around the province, to make sure they have the proper facilities. And if they need more facilities, we will do whatever it takes. Had a quick call, for instance, up in Muskoka. Mayor Graydon Smith, I got off the phone with. He had some concerns. Everyone's heading up to the cottage to get away from the city, and it's getting pretty busy up in the Muskoka region. And so we're going to make sure we address the issues and any requirements that they have. As I've said over and over again, I will spare no expense to protect the health of the people of Ontario, along with making sure that we keep the supply chain going until people can go into the stores and get the essential items that they need.
And Premier, in California, what they're doing with the homeless population is they're moving them into unused motels and hotels because they're largely empty right now. Student residences that are empty. Experts here are recommending the same. Would you consider that? Is that viable?
That's on the table already, and I want to thank all the hotel owners that have come forward. I know there's one hotel just right across from St. Mike's there that have 200 and I think 60 some odd rooms available. My area up in Rexdale, we probably have more per capita than any region in Ontario along the airport strip. Everyone's coming together, and that option's on the table right now. Matter of fact, all options are on the table.
Next question.
Next question comes from Travis Dunrush of Global News. Please go ahead.
Good afternoon, Premier and Ministers.
Hi, Travis.
So, yesterday I asked you about the possibility of a full shutdown. I know Sean just asked you this again. Does it really take a rocket scientist to figure out where things are going here in this province? You said that you're waiting for the advice of Dr. Williams and his team. Well, we know that the data that they are using to advise you is old and often inaccurate. So with the case numbers continuing to multiply, you're ultimately in charge here. Why can't you look at what's happened in other countries, take the reins, and implement a full lockdown?
Well, Travis, first of all, we've already compiled a list. We're being proactive in the fact that we've compiled a list of what we feel are essential services. I'll give you an example. Anyone who supplies retail, anyone who supplies medical devices, hand sanitizer companies. I'm going to go make a whole list, so we've compiled that, and eventually I think we may be going down that road, but we are prepared, and I'm no medical expert. As I say, I have to rely on the medical expertise of our COVID-19 command table, the Chief Medical Officer of Health, but we are prepared, and we have a list. We've asked every single ministry days ago to put together their list, and their list is available for companies that we feel we need to keep the supply chain going, make sure people are fed, make sure that we have essential items in the grocery chain. So we're ready.
But I guess what I'm wondering is, are you factoring in that the data that you're getting and the advice that you're getting from Dr. Williams and his team are based on old data? I mean, sometimes it's taking 7 days for test results to get back. They're not testing everyone. And in some cases, like Cynthia mentioned, there could be community transmission. So it's not a fulsome picture. Are you factoring that in ultimately when you make your decisions?
Well, again, Travis, we have to listen to the health professionals. We're ready when they give us the word to start shutting more areas down. But in saying that, Travis, I think it's we need people to use common sense, and 99.9% of the population is doing that. I know we had an incident with one of the stores opening and people lining up, and I noticed they were keeping their distance from each other, but we have to use common sense, and the majority of the people are. We need the help of the people to make sure this happens. We can't do this alone. I've said over and over again, if you don't have to leave your home, don't leave it. If you have to go get essential items, we understand. Go by yourself. Go into the store by yourself. Go in and get out as soon as possible. But we do need the support of the people of Ontario, and we're getting that support. I'm just amazed on how everyone's coming together, and they're doing an incredible job, and we're all working together.
Okay, we have time for one more.
Last question comes from Haley Cooper of News Talk 1010. Please go ahead.
Good afternoon, Premier. Earlier this week, you said that peak and off-peak hydro rates would be adjusted in light of people self-isolating and social distancing. So where are you with that, and when will we see those rates adjusted?
Well, that came to Cabinet last night, and you'll hear an announcement over the next few days, but we're going to move quick on that, and it's just one small way of helping people. I can't always say a lot of these measures may not be permanent, but what we want to do is give relief to families and take the burden off people. If they're at home all day because they're self-isolating, they may want to do the wash at noontime instead of waiting at nighttime, off-peak hours. They might want to do some cleaning, vacuuming. They should have that flexibility, and we'll make sure we give them that flexibility to get through these tough times.
And Premier, I think a lot of people are going to hear your plea today and really be taken aback by the acknowledgement that there is a shortage of these key medical items. So how dire is this situation, and what's the plan B if the manufacturing sector can't pump out enough of these items and fill the void?
Well, I think anyone that's been watching the television knows a lot of these medical supplies, essential items, when you have the whole world you know, billions of people all wanting the same supply. As a business person, I don't like relying on other countries. They have their needs. When you have, you know, a manufacturing base here in Ontario that can produce absolutely anything here in Ontario, we're going to start that engine and we're going to go full steam ahead. I don't want to rely on the 5 companies or 6 companies down in the U.S. And God bless them with the ventilators. I was on the phone yesterday with the president of GE trying to get as many ventilators. There's Medtronics and Philips. They're all great, great companies. And they're doing everything they can to help Canadians. But for instance, DuPont, the Tyvek medical outfits that they're making, DuPont's not shipping up to Canada. They're keeping it down in the States right now. I don't want to rely on them. I want to make sure we have the manufacturing might. We do it here. And we put the call out, and it's absolutely incredible. I'll tell you, I know the Minister of Health is doing an incredible job. Our procurement department is doing a great job. So is the Minister of Economic Development, Vic Fedeli. We have to start doing these items here. As the Minister was saying, that we have distillers turning over to hand sanitizer. You go into the stores, we didn't have hand sanitizer. Now we have everyone producing hand sanitizer. We'll have enough. We have 12 million surgical gloves on order right now. We have the N95, over 1 million N95 respirator masks on order. As I mentioned, I was on the phone with the president of 3M that manufactures these. We want manufacturing here in Ontario. We have the capabilities. I spoke to 2 companies that does the alcohol wipes, the cloth wipes. We wanted them to ramp up and at full capacity, and we'll do whatever it takes to make sure we help them. I can't rely on the rest of the world right now, 100%. We're all trying to help each other, but when you have the capability, some of the brightest people in the world right here, we have the equipment, we have the manufacturing capability. There's nothing we can't build. And once we start building and gearing up, on the talk with the other premiers around this country, they're relying on us. They're relying on us to make sure when we ramp up, we make enough for everyone in Canada. This is a Team Canada approach. And we're all working shoulder to shoulder. And we'll get that engine going. And once we fully ramp up, we're going to start mass producing these items. And I want to thank the people for the response. Right across this province, I've just been inundated with calls and stories I could tell for the next hour. I want to thank the businesses for stepping up, and Mr. Volpe and his association and members of the auto part manufacturers. But it's not just the auto part manufacturers, it's everyone across this province stepping up and ready to do their duty. And I want to thank them, and God bless them. Thank you, everyone. I appreciate it.
Good.
Thank you.